Hello, my name is Amber Wilson, and today I'm going to talk to you about ovarian cancer. There are many types of cancers, such as brain, lung, bladder, colon, ovarian, etc. Ovarian cancer is a disease that is caused by abnormal cells in the body and which grows out of control. Ovarian cancer is a cancer that starts out in the ovaries. Oftentimes it can spread outwards to the stomach and pelvic area. If this happens to go untreated, there are 3 different types of ovarian cancer: epithelial ovarian carcinomas, germline cell tumors, and stroma cell tumors. Epidemiology is the part of a medical science that handles the distribution, incidences, and potential controls of diseases, plus the factors that are related to the health of the patient. Ovarian cancer can affect any female regardless of age and nationality. It is the 7th most common cancer that affects women. There are a few risk factors that could cause ovarian cancer. They are as follows: getting older, obesity, having late-in-life children, or not carrying children to full term. Also, a family of history of ovarian cancer. Incidences and rates vary amongst nationalities. They also vary amongst ages, ranging from babies to seniors. The incidences among babies are very extremely rare and goes up to common in adults and in seniors. Awareness of the disease might increase the rate of incidences being reported, more so than in the past, although the treatments themselves have decreased the rate of death. Despite the fluctuation in the numbers, it is still a high-risk cancer that affects many women. Symptoms of ovarian cancer includes bloating, frequent urination, upset stomach, which includes constipation and heartburn, inability to eat, back pain, fatigue, pain during intercourse, and changes in menstrual cycles. Oftentimes these symptoms can be confused with symptoms of other diseases. The other diseases that these symptoms can be confused with is basic back pain, such as sciatica, ovarian cysts, and even IBS, which is a irritable bowel syndrome. If you have any of these kinds of symptoms, it's best to talk to your physician or your OBGYN about them. Ovarian cancer is diagnosed through multiple methods. These methods include a basic pelvic exam from a person's OBGYN. Other methods include surgical biopsy, transvaginal ultrasound, and a tumor marker detection. There are many genes that causes ovarian cancer. Germline mutations are mutations that are detectable through the variation that occurs inside germ cells. Lynch syndrome is a mutation that is inherited and generally affects people that have a higher chance at developing the cancer that is correlated with it. This type of cancer generally happens before the person reaches the age of 50. In germline mutations, the genes that cause ovarian cancer are the BRAC1 and the BRAC2. In Lynch syndrome, the genes that causes ovarian cancer are MLH1 and MSH2. The most common type of ovarian cancer is germline mutation, which, as I have stated in the previous slide, is hereditary and is caused by either the BRCA1 or the BRCA2 gene. These two genes are proteins that deals with repairing the damaged parts of the DNA. And when they are mutated, they do not repair the damage in the DNA, which causes them to mutate out of control. In ovarian cancer, the dysregulation of the cell cycle control that affects the G1 transitioning to the S phase is the interruption in the pathway that is responsible for ovarian cancer. Like most cancers, ovarian cancer uses glycolysis to create ATP. There are treatments for ovarian cancer. Radiation is one of them. Radiation therapy is one of the treatments that's treated in ovarian cancer. This therapy is known as intensity modulated radiation therapy. The way it works is that the radiation is externally delivered via a machine and aimed in the direction of the tumor. It basically firing thin beams of radiation from different angles. This keeps the amount of damage in the surrounding areas at a minimum. This treatment is only used for certain types of cancers, so it's not used on all types of cancers. There are other types of treatments used for ovarian cancer, such as chemotherapy, surgery, and medication. Through surgery, parts or all of the uterus is removed. It is known as a hysterectomy. For chemotherapy, this targets the cells, but since it's non-discriminatory, it tends to target all of the cells. Medicines that are used are such as chemotherapy pills and other medicines prescribed by a cancer doctor. All treatments have been proven to be successful, although not 100% successful. It is still a higher amount of success than it has been in the past, and people tend to have a better success rate of surviving cancer than they have done before. That is all for my presentation, and I would like to thank you for watching my presentation. I would also like to thank my teacher for teaching me everything that I needed to learn in order to complete this presentation, and also to all the wonderful websites that provide us on a daily basis with the information and tools that is needed to understanding and diagnosing cancers such as ovarian cancer. And again, thank you for watching my video and have a wonderful day.